go ahead then. Well, I'll give the floor to Reed Lindsay from Belly of the Beast, and I'll explain a bit more about what they do after he's spoken. Thanks.
Well, thank you very much. Thanks to Rock Around the Blockade and Helen and everyone who's participating. It's an honor to participate. And you know, we formed Belly of the Beast last year, and we did this documentary series called The War in Cuba, which was really focused on the intensification of the economic war against Cuba under Trump. And as 2021 came, we weren't sure. We were continuing as Belly of the Beast, but we weren't sure if we would continue doing the war in Cuba, because presumably the war in Cuba might change, and we thought it might be irrelevant after 6 months or a year. At least some optimists thought that. And unfortunately, the war in Cuba is very much continued, and we are doing War in Cuba Part 2, essentially a continuation of the series because it's more relevant than ever. You know, when Biden first, I thought I'd just take time to talk a little about Biden's policy and about how we've seen it here on the ground in Cuba. You know, initially, Psaki, the spokesperson, kept talking about the two pillars of his policy, which is human rights and democracy, and we're going to listen to Cuban Americans, which you could interpret as just they're going to maintain the status quo, or they're just trying to make people in Florida happy for the meantime. And the optimist thought it was the latter, but then nothing happened. And then on April 8th, Juan Gonzalez has sort of become the de facto spokesman for Biden on Cuba policy, spoke to CNN. And I thought it was remarkable how honest he was. Instead of speaking this code, just repeating this mantra about the human rights, democracy, and listening to Cuban Americans. He said, Biden is not Barack. You may have listened, forgive me if you all have heard this before in the old news, but it never ceases to amaze me how honest it is. He says, Biden is not Barack Obama on Cuban policy. Those hoping for dialogue with Cuba don't understand the political moment. The political moment has changed. The political space has closed. Biden is not going to invest the political capital to implement policy changes now, initially. And that pretty much summed it up. That was in April. The Biden administration said they were doing a policy review, except there's no evidence they were doing any kind of serious policy review. They seem to just be stalling and waiting to see what would happen. And of course, they knew very well that Cuba was facing a tremendous economic crisis due in part to US sanctions and in part because of COVID. And as time went on, then July 11th happened, and then that changed everything. But just to take a step back, one other thing that Gonzalez said in that interview with CNN is that they asked him about why, when is the US going to start processing the 20,000 visas that it's supposed to give every year to Cubans to go to the United States? And he said, that depends on reopening the embassy, but we can't do that yet because until we make sure our personnel there are safe, and we don't want them to run the risk of a microwave attack or whatever it is they're calling it these days. He literally said that, which is, I thought, very telling because it shows that it really doesn't matter what they're calling it, because it never really was important what it is, because it doesn't seem to be anything at all. So it's 4 years of that, and we'll be getting into this in the war in Cuba, in the continuation of the war in Cuba. We're taking a deep look at what happened at the embassy. And 4 years have passed, and there's still no evidence that there were any attacks at all. And I found it amazing how the media has reported about sonic attacks and then seamlessly transitioned to reporting on microwave attacks without really ever acknowledging the fact that the idea of sonic attacks was discarded. And now microwave attacks has become sort of a consensus. The problem with the theory of microwave attacks, of course, is that there's no evidence that any kind of weapon in the world exists that could be effective as like a microwave weapon. In fact, the military has been trying for decades to produce such a thing. We interviewed Cheryl Rofer, who worked at Los Alamos National Laboratory for decades, and she explained that she actually was looking into microwaves there and seeing how they could be used to access oil shale beneath the surface of the earth, but discovered that it wasn't possible because it can't bypass everything in between. And in the same way, a microwave weapon wouldn't be able to affect someone's brain and cause nausea and dizziness, which were the symptoms reported by embassy personnel there, without first melting people's flesh or affecting their skin. basically, the long story short, there is no evidence of a weapon of this nature. And yet the National Academies of Science, Engineering, and Medicine came out with a report, which seems to be now the definitive report at the end of last year, stating that microwave attacks were the most plausible of all of these different, not so plausible options. They had no experts on microwave attacks in their panel. And they really didn't present any evidence that such a thing could occur. Yet the media continues to report on this. And what the media does not report on, and what this panel, this National Academy of Science, Engineering, and Medicine, NASA, did not report on or look into with any depth, is the possibility that the causes are psychological, which I believe is the most, it seems pretty clear, is the most plausible and likely possibility, just because, again, without any evidence of any kind of weapon that can cause the type of symptoms that people are reporting, and the fact that if you talk to neurologists who have looked into this issue, there are these type of symptoms, dizziness, nausea, and so on, are very common when the causes are psychological stress, anxiety, and so on. And when you have a bunch of people in a bubble all together, and suddenly they're being told they're under attack, and their sonic weapons and so on, then the possibility of having a psychologically related symptoms is much, much higher. I don't know that that's the case, but it's certainly a very, I think, one of the most likely explanation, and it's one that really hasn't been looked into at all. So we'll be looking into that a bit in the war in Cuba, in the continuation of it. And I thought I'd just jump to, real quickly to Biden's policy after July 11th. He's basically stalled, right, for 6 months. He said he was doing a policy review. There's no evidence he was doing anything. He was just waiting. Maybe he was waiting for 2022 elections in Florida, see how things went there. He's afraid of being called a socialist in Florida, so he doesn't want to do anything that might be perceived as being soft on communism in Cuba and engaging with Cuba. And then July 11th happened, and the door seems to be closed completely, because now he seems to be completely assuming Trump policy. And I just want to look at 3 things that he said, because it's so, being in Cuba and seeing US policy here, it sometimes just borders on the absurd. The gap between what people say in Washington, how the politicians and analysts and so on, how the media reports on that, and then the reality here on the ground. It's 2 completely different realities. So there are 3 things that Biden said that he would do after July 11th to help Cuba. He was going to bring the Cuban people internet. He was going to find a way to get remittances to the Cuban people that circumvent the Cuban government. And he was going to bring vaccines to the Cuban people. The crazy thing about these 3 things is that Cubans already have all of those 3 things. They have internet, as you can tell. I'm in Cuba and we're speaking over internet right now. They have vaccines, as I'm sure most people here know. Cuba has an incredible biotech industry and is producing its own vaccines, and more than half the population is vaccinated, and probably very soon will soon overtake the United States as far as the percent of its population that's been vaccinated. And also, they actually do have remittances that bypass the Cuban government. Unfortunately for the Cuban people and for the family members in the United States, they get here in a very costly way. Whereas if Western Union was functioning, a family member of a Cuban in the United States would pay a 10% fee, and then the person in Cuba would send $110, $10 fee. The person in Cuba gets $100. Right now, the family member in Cuba would have to use a service such as I called one the other day called Va Cuba. And when you factor in the exchange rate and what the Cuban family member in Cuba actually gets, the person in Miami ends up paying $140 for the person here to get $100. It's not we can get on the phone right now and set up a transfer and make it happen immediately. So remittances are getting here. None of that money is going to the Cuban government, but it certainly doesn't benefit the Cuban people, because you have these businesses in Miami that are taking 40% markup instead of a 10% markup, only of which a tiny percent would actually go to the Cuban government. I think around 1%, which is standard for the world. Quickly on the issues of internet and vaccines, internet is another remarkable one, because I've been researching and I just can't believe how many articles I've seen about bringing the internet to Cuba, and they all presume something which is just not true, which is that there is no internet here. And of course, there is internet here. Internet was cut for a few days, but it was only kind of mobile data. It continued to work in the Wi-Fi parks, continued to work in people's homes. Like I have an outdoor guard, I have access to internet in my home. Now most people don't, but they're still able to access it. And it was only out, and it was intermittently out for a few days. And this was a very rare occasion. So the internet is working fine. And you have all these ideas being floated like stratospheric balloons and satellite, and they want to set up a Wi-Fi hotspot in Guantanamo Bay. And all of these ideas are essentially harebrained, or they possibly are ways to get money into the hands of contractors who are friendly with the politicians who are promoting them, because satellite and stratospheric balloons would require people in Cuba to have devices to connect to those things. And so how are you going to get those devices into Cuba? Basically, there's no way to get internet to Cuba without participation of the Cuban government. And again, the whole discussion is pretty absurd considering there already is internet here. There is a way to improve internet, which is that there are submarine cables that basically surround Cuba. If you look at a map of the Caribbean, there's cables running all around, and Cuba is all these cables are surrounding Cuba. There's one cable entering Cuba. That's the only source. That's the source of the internet from Venezuela. Meanwhile, there are a bunch of cables that pass by from the United States to Mexico, and they go right by Cuba, just about 30 kilometers off the coast. But because of US sanctions, Cuba is not able to connect to those cables. And then finally, on this issue of vaccines, it is either incredibly ignorant or incredibly cynical that the Biden administration is talking about bringing vaccines to Cuba. He said bringing vaccines only if an international humanitarian organization distributes the vaccines. And of course, that for Cuba, where there really aren't international humanitarian organizations in the area of health, because Cuba has an incredible healthcare system that is extensive, and every single neighborhood has a health clinic and a doctor. And it's sort of like offering vaccines to Cuba, saying that an international organization has to distribute them. It's sort of like offering food to someone and saying that they can't use their mouth to chew it. It's one way that the Biden administration could help Cuba, though, is again the U.S. embargo, because if you look at Cuba is facing a crisis in COVID, like many countries around the world, especially the Delta variant in recent months. In fact, the vast majority, I think upwards of 80–90% of the deaths in Cuba have occurred since July 1st. Now, I live in a neighborhood where I was supposed to get there are two main vaccines in Cuba, Soberana vaccine and the Abdullah vaccine. I was supposed to get the Soberana vaccine on May 14th. In fact, the local doctor told me in my neighborhood, said that I would get it. All my neighbors were told the same thing. And suddenly we were told, no, it's not going to happen right now. And it won't be Soberana, it will be Abdullah. And I wondered what happened with that. And I finally was able to find out. What happened was that Soberana production was delayed for months because it requires certain ingredients that the Cuban government was unable to get because a reliable provider that had provided them with these ingredients to make vaccines for decades suddenly stopped, citing the sanctions. And as a result, Cuba's production of the vaccine was delayed by months. Now, if you look at that and the time period we're talking about, and the fact that you have thousands of people who have died since late June, early July. All right. And then you look at the fact that these protests, for example, happened on July 11th, and they were, people were not protesting because of the vaccine, but they were protesting because of the economic crisis here. You wonder how many lives the embargo has cost. It's something I've looked into a lot as far as the impact on healthcare. And sometimes it's hard to see the impact of the embargo on healthcare in Cuba because the Cubans they're incredibly resourceful and they find amazing ways of still providing healthcare to the people. But this case I find shocking. And I think that there's absolutely blood on the hands of the Biden administration for not only maintaining sanctions, but but intensifying sanctions during a pandemic that it has possibly led to this to fewer vaccines being in Cuba, and you wonder how many people would have been vaccinated, how many people ended up dying, could have been vaccinated if there hadn't been that delay in the production of Soberana. So unfortunately, the situation in Cuba is very bleak. I wish I could be optimistic with this administration, but it's very hard to be right now. And I think, as Max said, it's important for all of us to keep doing work as journalists and activists to keep sort of telling the truth, because unfortunately, a lot of the major media outlets that are covering Cuba are not doing so. Thank you very much.
Thank you, Reid. Really appreciate you joining us tonight. Yeah, I would really recommend people follow Belly of the Beast. So, you know, you've been producing some amazing videos, documentaries. There is the War on Cuba series that Reid mentioned. and that explores like the impact of the blockade, but also just really valuable short interviews with Cubans on the street about, what do they think about, military intervention from the US? What do they think about, this idea that Cuban doctors are slaves? I mean, these are precisely amplifying the voices of the ordinary Cubans in Cuba whose voices are silenced by our media. And it provides an antidote to The Guardian and the BBC and the mainstream media outlets that we've been protesting over against the narrative on Cuba. So yes, please follow them, please help share, and the links are in the chat.